Taking a closer look at healthcare in America and what some say needs to change. The Collective Cure by Dr. Monica Wang explores upstream solutions for better public health. Wang is an associate professor at the Boston University School of Public Health and an adjunct associate professor at the Harvard T.H. Chan School of Public Health. She joins us now in studio to talk more about her book. Thank you so much for being with us.
Thanks for having me.
I'm excited to talk about this because your book, The Collective Cure, it points out flaws with the healthcare system. What are some of the issues that you flagged and why it was important to do so?
Well, we spend a lot of our resources downstream, and these are things like medications, surgeries, hospitals. It's great for when people get sick or are injured, but we spend a lot less resources further upstream. So if we move further upstream, we start to think about health behaviors like eat healthy, eat fresh produce, engage in exercise, see a doctor. But what happens when you don't live in a neighborhood that has a grocery store? There's months-long waiting lists to see the next primary care physician. And so when you move upstream, it's about the environments that make those healthy behaviors possible in the first place. So this book underscores all of the other factors outside of healthcare that really impact our well-being.
Our day-to-day issues. I know throughout the book, though, you weave in your personal story into this. I know you were born in Wuhan, China. You talk about that and your birthplace, the COVID-19 pandemic, your public health background, kind of all overlapped in 2020. What did the pandemic teach you, and did that drive you to write this book?
That was certainly a catalyst for it. And I came to the U.S. when I was 3, and my parents immigrated here, and we decided to build a life here. So to Boston we moved and became citizens. And then 2020 happened. And most of the time when I talked to people about Wuhan, they had never heard of it before. And now it was on the global spotlight. And what was compelling and surprising to me is that what happened there also happened here. And so some of the lessons that we learned is that whenever a disaster strikes, whether it's a pandemic, a hurricane, a tornado, wildfires, our systems really become exposed in terms of how either strong they are or how weak they are. So we know from the pandemic that it's not simply about hospital beds or vaccines, and that it's really what is our data monitoring infrastructure? Do we have effective, safe, trusted health communication? Do we have livable wages where people can access fresh produce, access vaccines, sign up, and even learn where they are being offered? And the two other things that came to light, one is that it also showed us how interconnected we actually are. So in addition to the virus being spread, it also matters that we're investing in the health of essential healthcare workers. It matters that we are paying people affordable living wages because not everybody could stay at home and work from home or go to school from home. So there were a lot of ripple effects from the pandemic. And the third part is it exacerbated rising rates of loneliness and isolation. And that had already been on the rise, but it really showed us, especially during lockdown, we're really wired for connection, and that in-person relationship building is really important for our well-being.
And it's kind of still showing us that, right? I mean, so much has changed ever since then. I know your book, you tell the stories of 3 women of color. You have a Latino student from the Bronx, you have a Black community organizer in rural Alabama, and you have an indigenous clinical social worker in Texas. Why did you choose these 3 lenses to focus on?
Well, the story of public health is inherently collective, so I knew this wasn't going to be a memoir. I really wanted to meet and learn the stories of people from across the United States, from different generations, different backgrounds, who had different life circumstances, and hear their stories, and through the stories show how our environmental conditions, our social conditions really shape our health above and beyond genetics and healthcare access or health behaviors. And it was really wonderful getting to know all of these women. I've met all of them in person. I've worked with Maria Elise very closely because she was a student research assistant for me. And they are amazing. I can't wait for the world to hear their stories.
Yeah, amazing. From writing this book, from your experience, what solutions do you propose to the flaws that you address in your book?
Well, what's exciting for me is that the book also showcases case studies where we've had success. So you may have heard of Blue Zones, and Deb Buettner and his colleagues, they explored the world and found places where people were living well into their 90s and 100s, and not just living long, but living healthy lives. So places in Okinawa, Japan, Sardinia, Italy. And what they learned is that good health isn't accidental. It's built in by design into their communities. And the bigger question that they asked was, how can we take communities that are unhealthy and move them closer to a blue zone? So creating conditions in which communities that are dealing with heart disease, diabetes can thrive. And they created Blue Zones projects. So they targeted communities across the US, and they had 3 pillars for change. One was policy, so changing the rules of the game. So smoke-free parks, creating financial incentives for grocery stores to open in underserved areas, investing in more safe, walkable spaces. The second pillar was the environment, and so creating more green space, building more sidewalks and bike paths, creating more traffic stop signs so that traffic is slower, because when people feel safe enough to walk and bike, it becomes a natural part of your daily life. And the third pillar was community. You can't change policy and environment with getting the community on board. So there was buy-in from local businesses, from schools, and people really focused on building social cohesion and trust. And when all of those 3 things were implemented together, they saw decreases in cholesterol and blood pressure, more consumption of fresh produce, and even increases in life expectancy in some of these communities.
Amazing. Thank you so much, Dr. Wang, for being with us. We truly appreciate it. And thank you so much, everyone, for watching. Be sure to follow us on Facebook and Instagram. You can watch the show on a very local app as well. Have a wonderful afternoon.